My talk is What Killed Elvis. I'm going to be talking about symptoms that almost everybody in the world has had at one time or another: nausea, vomiting, constipation. But as everybody in this conference knows, some people have other illnesses that make these much more common, and we're talking about patients who suffer from this on a weekly and a daily basis. Basically, the take-home lesson from this talk is that these things are common, they can be lethal, and they're treatable. I'm going to talk about three people we all know and who turns out had motility, gut motility problems: Johnny Cash, Tammy Wynette, and Elvis Presley. And that we look at the three different parts of the intestinal tract: the stomach or foregut, midgut, the small intestine, and the hindgut, colon, for Elvis Presley. Johnny Cash died at age 71. He had a long battle with diabetes, and he had multiple medical problems. A lot of them were related to his GI motility disorder, which turned out to be gastroparesis. He had a lot of the lung problems associated with gastroparesis and chronic reflux. For a while, they thought he had something called Shy-Drager disease, which is an autonomic nervous system disorder, but then it turned out that he just had autonomic nervous system problems without this Shy-Drager disease, and it was gastroparesis. Shy-Drager's is autonomic nervous system disorder that involves both the central and sympathetic nervous system, and they get a lot of dizziness and postural hypotension, which we've talked about a lot at this meeting already. There's other symptoms, some of which he had, some of which he didn't. And basically, a lot of his symptoms were related to this reflux and autonomic nervous system disorder that he had, and he was hospitalized multiple times for aspiration pneumonia. And then finally, though, his doctor, they decided he had autonomic neuropathy, which is what a lot of these GI motility disorders are. And this is what they decided: he had autonomic neuropathy associated with diabetes, which basically is gastroparesis that we talk about here. He had weight loss, nausea, and vomiting, and then died finally of pneumonia. Gastroparesis, 5 million Americans have this. 20% of type 1 diabetics have gastroparesis. Diabetes, of course, is obviously very common. 5.8% of the United States population, 15 million people. This is a study done in 2002, which showed that they looked at patients with long-standing type 1 and type 2 diabetes, and they showed that 30 to 50% of patients with long-standing type 1 or type 2 diabetes had some delay in their gastric emptying if you do a gastric emptying scan on those patients.